Breast augmentation or breast enlargement is a very commonly carried out operation in cosmetic practice, and it involves enlarging or enhancing the size of the female breast. The patients that come seeking breast augmentation really fall into two categories. Those ladies that have very little breast tissue and are looking to increase the size of the breast to something that's very moderate. And then at the other end of the spectrum, some ladies wish to be significantly enhanced because this is the body image that they would like to portray. The breast implants themselves are made of silicone. They come in a number of shapes, and that's generally a round shape, which was the traditional breast implant. And then more recently, the teardrop or anatomical implants have been introduced to the market. These are made of slightly firmer silicone, and they're described as form stable, which means when you lie them down or stand them up, they maintain the breast shape. Whereas the round implants are slightly softer in this case, and when you hold these upright, they again create a breast shape. But when you lay them down, they flatten off, giving a slightly more natural feeling and natural position. We have full discussion with the patients about what they would like in terms of texture, because the breast implants come from soft to relatively firm, and these have different characteristics after they've been implanted into the chest. The implants as well come in a number of projections, from high projection through to the much lower projection. One of the critical things to decide is where the breast implant is placed, and there's two common places that it's put. One is above the muscle, sitting directly under the breast gland, and one is underneath the muscle. And this will determine both how long the operation takes, and it will also to a certain extent determine how painful it is afterwards. Breast implants placed under the muscle are generally slightly more painful than those placed above the muscle. The operation itself usually takes somewhere between 45 minutes and an hour and a half, depending on exactly what sort of implant you're putting in and the position you're putting it in. And the implant is usually placed through a short incision underneath the breast, measuring about 4 to 5 centimetres in length. The advantage of this incision is it leaves a scar which generally fades very well and is not visible to the patient from above. Many patients stay in one night after a breast augmentation, and this allows us to monitor them in the post-operative period to make sure they don't have any early post-operative complications. But more and more, we're undertaking breast augmentation as a day case procedure. Aesthetic or cosmetic operations are the same as any operations. They do carry risks, and I would divide those risks into the general risks of any operation, and this would be bleeding, infection and scarring. The specific complications of breast surgery with implants usually relate to the implant, and that can be implant failure, where the implant breaks. Again, with the newer implants that we use, this is very unusual. More significantly, perhaps up to 10% of ladies over a 10-year period will get something we call capsular contracture. And this is a hardening of the implant or a hardening of the tissues around the implant, which can distort the implant and therefore change the shape and, most importantly, the feel of the breast. Now, the patients will immediately notice a difference in the shape and the size of their breasts after a breast augmentation. Initially, the breasts are going to be swollen and quite sore because of the surgery itself. But as the swelling comes out of the breast over the first few weeks after surgery and things settle down, everything softens, we start to see the end result that we hope to maintain for many years. Breast implants themselves do require some form of maintenance. The breast implants we're putting in today will probably have a lifespan in excess of 10 years. But after about 10 years, it's probably worthwhile having them imaged yearly to ensure that they haven't ruptured and that there isn't any silicone leaking from them, which may necessitate an operation to remove the damaged implant and replace them with a new one.